Gerry has just come out of a consultation with her oncologist and seems upset and frustrated. The nurse sees this and asks if Gerry would like to have a chat before she leaves. Gerry has an advanced cancer and has increasingly been getting more pain and fatigue, loss of appetite, and she knows she's approaching the end of her life. Her palliative care doctor is amazing and really listens to her, but she doesn't think the oncologist is doing the same. The oncologist is keen to give her more chemotherapy, but Gerry isn't keen to receive it. She doesn't want to be tied up coming to the hospital and suffering the additional effects of chemotherapy on top of everything else. She wants whatever time she has left to be as good as it can. She doesn't feel listened to or understood by anybody and is frustrated. She wants the oncologist to tell her that the chemotherapy would not interfere with her quality of life, and that if it's going to extend her life, it will be by 6 months or more, not just 1 or 2. In addition, she also sees a different doctor every time she comes to the hospital and feels that there really is no continuity of care. So I brought you in to the quiet room to have a conversation because you just looked really upset when you came out from seeing the doctor.
Yeah, it's been really bad actually, to be honest with you.
It's been really bad?
Yeah, I mean, I feel really frustrated about everything, you know. I mean, I've been pushed from pillar to post, to be honest with you. And, you know, see all these different doctors. You have to explain everything each time. They don't seem to be prepared. And I certainly didn't get any information from the oncologist just now, you know, even though he wants to put me on the new drugs. So I know what's wrong with me, but nobody else seems to realise the effect it's having on me. And it's just not good enough, really.
So you feel that nobody is listening to you, is that right? And
yeah.
You feel unprepared?
Yeah, I mean, you know, it's not only me. I've got a husband to think of as well. You know, he worries about me. And the thing is, now they want to put me on these other drugs. You know, I'm thinking, well, is it worth it? What about my quality of life? Can you tell me how long I've got then and what this all means for me? And I can't seem to get any answers at all. And I'm sure they think I'm being difficult, but like you say, they're just not listening to me. And I'm not a piece of meat. I'm a person and I want to live, and I know I haven't got long. And so I think out of respect, somebody should tell me what's going on. I'm sorry.
You know you haven't got long.
Yeah, I know that this is bad. Yeah, I know this is bad. But they don't make it any easier. They don't communicate at all. You know, I mean, I'm so grateful that you've been talking to me today because I wanted to tell somebody. I just want a bit of consistency in my care. Do you see where I'm coming from?
I do, and that's very reasonable, isn't it?
I hope so. I really do. You know, I have to say that my palliative care nurse, she's been really fantastic. But I can't say that for everybody else. Half the time I don't know who I'm talking to.
So it sounds like you've had a really frustrating conversation with the oncologist today and you haven't got the information that you needed.
No.
At a time when you really need it to make some decisions about what happens in your future.
That's right. Well, she had a very gentle voice. She was very warm in her manner. And I knew that she wasn't only listening to me, but she was hearing every word I said, because she was acknowledging and sort of repeating back the things I'd said. So I knew she was on the same page as me.